used in a controlled setting, people are also capitalizing on the photosensitizing effects of St. John's wort and delivering it to the esophagus, delivering it just topically on the skin for melanomas and basal cell carcinomas, or instilling it in the bladder. And then you can expose those tissues instead of to radiation. An alternative to radiation therapy is you can then expose the bladder to something like a strong LED light, something that's not damaging to the normal tissues at all, does not have any sclerosing effects on the healthy cells down the line. And it's been shown that many cancer cells will take up hypericin more readily than will healthy cells.
Basically, with botanical medicine, you guys, we learn how to do tinctures, powders, raw herb, make tea, and really I think some of the more cutting edge ideas are about how do you get better delivery systems for people. How can you get something into somebody in a way that's going to have the best therapeutic effect, and how can you make that available to them in some kind of an affordable manner. It turns out that most of the liposomal products that you find on the health food store shelves these days are not actually liposomes, they're emulsions in phospholipids. That doesn't invalidate them as products, it just means that they haven't really perfected that commercial production of liposomes. What we're trying to do is move that to a different place where we've discovered that there's a certain angle of the blade that you use to homogenize and really to encourage it.
Back in 2003, he started publishing a group of papers on amino acid therapy for neurological problems, neurological disorders. And what got me really intrigued about it is his research into Parkinson's disease. And I don't know if anybody here has experience with Parkinson's patients, but they're notoriously a really hard population of people to treat, hard to get them really well. You can oftentimes help get their symptoms ameliorated to some degree, but at some point, these people generally go on to L-DOPA therapy. They're going to take Sinovent or Parcopa, and they're going to combine that with an aromatic acid decarboxylase inhibitor. It's going to stop the L-DOPA from turning into dopamine in the periphery of the body.